Hi everyone, I am Dr. Swapnil, your spine doctor. Today we will be discussing about the cervical spondylosis. So what exactly is cervical spondylosis? It is nothing but it is a very common broader term which we will be using for the age related changes in your cervical spine. So if you have complaint of neck pain, stiffness in neck or arm tingling sensation or upper limb pain and your age is more, then you are having a very high chances that you can be having cervical spondylosis. Let us try to understand what is cervical spine and what exactly is cervical spondylosis. So when you look after your normal spine, there are the 7 cervical vertebrae which are present in the neck. So it has different components, like there will be disc in between the 2 vertebrae and there will be multiple joints which are called as the facet joints, and there are some of the ligaments which are inside. So whenever there is a age related degenerative procedure which happens because in this disc or the facet joint or in ligaments, this is when we call it as a cervical spondylosis. In case of cervical spondylosis, if we want to know what causes it, first is the most important factor which is there is the age related degeneration. As your age progresses, the ligaments, the disc start having age related changes, and that is where the symptoms of the cervical spondylosis occur. Second is, if you have definitely what I previously discussed, like if you're not sitting properly, if your habits are not good, you're smoking, making heavy lifting movements, that also can be related with your chances of having cervical spondylosis. Third is a genetic predisposition where some individuals are particularly prone for developing cervical spondylosis. So what are the symptoms which are related with cervical spondylosis? If in the initial early days, what happens is most of the people will be complaining of neck pain or stiffness, or they will be having complaining while making neck movements because of the disc pressing the nerve. Patient may have upper limb pain, upper limb tingling sensation, upper limb paresthesia, or he may also develop having weakness in the upper limbs where the patient tells that he is not able to do his day-to-day activities, or there is a history of slippage of objects from the hand. When the spinal cord is getting compressed, we call it as a myelopathy, and in those conditions, patients may have difficulty in walking, they may have a balance problems, their body totally becomes tight, and in the final end, they may have bowel bladder disturbances in which they lose the control over the urinary motions. So what are the treatment options available if you have cervical spondylosis? First thing is, what we will be generally advising most of the patients using is a neck collar that gives a limitation of the movement, but it is only useful for a short term period. Secondly, you can do some physiotherapy exercise when you consult your local near physiotherapist. That also will be helping you. Some stretching exercises will be helping you. For your pain and stiffness, you can use some medications which will help you reduce the inflammations. And secondly, you can have a proper posture. Because of that also, while sitting you can maintain a good posture, that also will give you a relief. So in some conditions, what happens is the pain is very increasing, there is a walking disturbances, there is a loss of movement, loss of control of the hands. In such conditions, definitely surgery is the option which is a requirement in the betterment of your future and everything. So surgery, what can be done is, sometimes when there is a so much of ligament thickening, then we in those cases we go for a laminectomy. Or if the spondylosis has happened because of disc, then we go for a discectomy, which we called it as anterior cervical discectomy and fusion. Sometimes if there is a multi-level involvement and the problem is at different levels of the cervical spine, then we have to do a laminectomy and fuse your vertebra from backside. Even though like cervical spondylosis is age related changes, like not much changes can be made, but definitely like you can slow the progression of the disease. First is, you have to make a proper position while sitting, you have to avoid heavy twisting movements, you have to make position you while sitting, while avoid in this newer generation you should avoid excessive usage of mobile, excessive tilting. While sleeping also, you should maintain a good proper posture and you should have a proper pillow which is comfortable to you. And always definitely you should avoid smoking. Your weight loss also can help you in managing this disease process. So definitely this is a age related process, but it can be manageable. Thank you.